Welcome to an introduction to the Sexual Risk Cessation model, providing second chances for hope and health. I'm Michelle Watson with Public Strategies and will be moderator for this session. I'm proud to introduce Dr. Nanci Coppola, Senior Project Manager at Public Strategies. Nanci oversees training and technical assistance for SRAE grantees. She has decades of experience in the adolescent pregnancy prevention field in government positions and as CEO of a nonprofit providing health education, youth development, and SRAE programs in middle and high schools in New York City. She's authored 6 youth development curricula. Please see her full bio on the main event page. Nanci?
Thank you so much, Michelle. And good afternoon, everyone. Welcome to this session. As we work to promote a culture of hope and health for the youth, it's really important for us to use a framework which meets youth where they are and moves them on a continuum toward optimal health. Dr. Hellman spoke of second chances and the potential for a hopeful future that leads to higher expectations for oneself. A sexual risk cessation program model can provide that second chance for a hopeful future for youth who have engaged in sexual activity and wish to discontinue. This very brief presentation will provide an introduction to the sexual risk cessation model and the resources which you can utilize in your programs as you work to find out more about this model. So in understanding risk cessation, we want to start by thinking about what we'd like to do at the end of these few brief moments we have together. And I'd like for us to be able to understand the basics of the conceptual model, understand the factors that influence youth decision-making related to sexual activity, and also understand a little bit about the restorative role of risk cessation in providing both hope and health for the youth that you serve. So clearly, the risk avoidance approach, which we are all familiar with, where youth are not engaging in sexual activity, not only prevents unplanned pregnancy and STIs, but also promotes healthy outcomes by keeping youth on a trajectory toward optimal health, and it contributes greatly to positive youth development. However, for youth who have already engaged in sexual activity, we can work through a risk cessation model to help them discontinue sexual activity and move them back on a trajectory toward optimal health. In order to effectively utilize a risk cessation model in programming, we must first understand what a risk cessation model is and unpack the factors that influence youth decision-making and sexual behavior. Between 2018 and 2020, as part of a portfolio of youth-focused projects that were conducted by Mathematica and sponsored by the U.S. Department of Health and Human Services, 2 complementary models, one for risk avoidance and a second for risk cessation, were developed that aimed to guide efforts to promote optimal health by preventing youth risk behaviors. The models identify a range of factors that research has shown may influence youth decision-making, sexual behavior, and related outcomes. The original model was published in February of 2020, and the refined model, which included further research, was published in December of 2020. Today, as we speak about providing second chances for hope and health, we will focus on the research supporting the risk cessation model. And Michelle will be dropping into the chat box for you the links to the research that I'm speaking about. Since we have a very limited time together today, I would encourage you to read both of those briefs that were published by ACF on these conceptual models. Through a full review of over 248 peer-reviewed literature articles, multiple factors were identified that affect whether and when youth engage in sexual intercourse and other sexual activities. Bronfenbrenner's social ecological model is often used to organize factors according to their level of influence on sexual risk avoidance and cessation. Factors influencing sexual risk avoidance and cessation outcomes occur at multiple levels. From a person's environment, where we see neighborhood characteristics, the media, and state and federal policies playing a role, to his or her interpersonal factors, such as relationships and social networks, and finally, individual characteristics, such as biological, physiological, and cognitive characteristics, as well as behaviors, intentions, and beliefs, which impact decisions surrounding the cessation of risky behaviors. Each of these three factors can have positive or negative influence on risk cessation. For example, the literature shows that within environmental factors, media exposure to sexually explicit materials through internet, TV, and movies is a risk factor for sexual initiation and increased sexual activity in youth. Additionally, the use of or exposure to internet pornography was found to be associated with numerous risk cessation outcomes, including having recent sexual partners, ever having engaged in anal sex, and the use of alcohol or other drugs at most recent sex. On a positive note, the literature suggests that sexual health education programs can help achieve sexual risk cessation outcomes. Clearly, a risk cessation model is a viable option that provides hope to youth who are not currently on a path toward optimal health. The success of an optimal health approach is measured by maintaining a risk-free status or the degree of movement away from risk. So here in this diagram that denotes optimal health, our risk avoidance, which is our primary prevention approach, we are focused on the fact that all youth deserve to learn the skills needed to achieve optimal physical, emotional, social, and intellectual health. And here, youth receive the skills to build resilience and resist peer pressure. For youth who are on that continuum toward optimal health, they are encouraged to stay on that path. However, for youth who are at rest, we are encouraging a movement away from risk. So youth receive the skills to cease those risk behaviors and to avoid and return to a risk-free lifestyle. Youth are referred for screening treatments of STIs and STDs as needed. When the path toward optimal health is disrupted, we offer opportunities for recovery and restoration. In recovery, we seek to improve an illness or condition, and through restoration, we seek to help the individual return to a status of low risk to prevent an illness or a condition from reoccurring. When looking at a framework for sexual risk prevention, we must acknowledge that at any point in time, youth can be at different points on the continuum of change. Therefore, traditional models of sexual prevention may not adequately address the needs of all youth and young adults. Here, the secondary prevention needs are intended to address youth who desire to take a time out from sex and reestablish new sexual boundaries. Now, I want to take a moment here to be very clear that when we are looking at youth who are driven by their past decisions and experiences, whether those are voluntary or forced or coerced, it is very important for us to remember that forced, coerced sex is rape. We must be certain in these instances, especially when in the context of an educational setting, to ensure that we as facilitators or those who are working under us as facilitators understand the importance of reporting and supporting these youth without shaming, and ensuring that the support systems that we have include referral services that are followed up on for these youth. So when traditional models of sexual prevention do not adequately address the needs of the youth that we are serving, we can turn to a risk cessation model because it will provide an opportunity for restoring both hope and health. The specific outcomes in a sexual risk cessation conceptual model, such as recent sexual intercourse, reflect that youth may progress towards cessation through intermediate outcomes. Youth who are engaged in protected consensual activity need to understand that they are still at risk, and the level of risk, ranging from low to high, is determined by a number of different factors. So we should pose the question to youth, is not having sex an option for you right now? And as we work to move youth on a trajectory back toward optimal health, some sexually experienced youth might gradually decrease the frequency of sex and eventually discontinue having sex, whereas others might immediately discontinue having sex. The goal is to work to provide hope and ensure that youth see that returning to a lower risk or no risk status is a viable option for them. When dealing with youth who have experienced forced or coerced sexual activity, our goal is even more focused on restoring hope and placing youth on a trajectory toward optimal health. Using a risk cessation model, we must work to guide young people in understanding healthy relationship formation and provide hope and healing by guiding them to the extent possible to make healthier choices. When needed, we must judiciously involve social services and law enforcement without compromising the well-being of youth. So clearly, when we implement a risk cessation model, we provide second chances for hope and health as we move youth toward optimal physical, mental, social, intellectual, and spiritual health. The research provides insight into the potential health outcomes for sexual risk cessation model. And here on this slide, we can see both the positive sexual health outcomes, including a belief that risk cessation is a viable option, intention to practice risk cessation, reduction in the number of partners, reduction in STIs, and decreased teen pregnancy. The literature also shows us that there are non-sexual health benefits of employing a risk cessation model, including improved academic achievement, improved mental health, decreased drug and alcohol use, and improved relationship quality, as well as the increased likelihood of economic self-sufficiency. Thus, we are truly working through a risk cessation model to put youth on a trajectory toward returning to optimal health. I apologize again for the brevity and going so quickly, but Michelle, I think we have 2 minutes for questions.
Okay, and I have had a couple that came in. Nanci, can you describe some of the interpersonal factors that were found to influence sexual risk cessation?
Sure, Michelle. So interpersonal factors that really had an impact were those that were related to parents and families. Higher parental education was a positive influence. Living with 2 biological parents at age 14 had a positive influence. Having community connections and religiosity were both positive influences, whereas those things that we heard about earlier can be negative influences. We heard both Dr. Hellman and we heard Ruth and Anna Cody earlier speak about a history of abuse. It also has a negative impact here in influencing risk cessation, as does insecure attachment with peers and with parents or caregivers.
Okay, thank you. And another one was the environmental factors that were found to have an impact.
Certainly, environmental factors that were found to have an impact. I mentioned a few earlier. The media exposure had a negative impact. Use of or exposure to internet pornography also had a negative impact. But thankfully, what was found in the literature was that sexual health education programs, specifically risk avoidance and risk cessation programs, can have a positive influence on youth decreasing their risk behaviors.
Okay, and I don't see any other questions, and that we are out of time. That's a wrap. Nanci, thank you so much for sharing.
Thank you, and thank you everyone for joining.
Thank you, Nanci, and thank you, Michelle. We now have a 10-minute break until our next session, which will be the 3:30 to 4:15 Eastern field talk, followed by our closing session. They'll be in the same link. So we will see you guys here in just about 10 minutes at our next field talk session. Thank you.